Right. Hello, everyone. Thanks for joining us after slight technical difficulties. Here to our talk today on how to become a health psychologist. Kiran, I feel like you're almost like a part of the department now. The number of talks you are giving in our department, especially in the last weeks and months, it's amazing. It's wonderful to have you back as an alumni of City Psychology in general, health, the School of Health in particular. We will learn more about you and what you do throughout this talk. So I won't introduce you like more formally. I leave that to you. You can do that better anyways. The only thing I want to say to the students who are here, if you want to ask me any questions during the talk, just or ask questions during the talk, I think the easiest way is to just use the chat function. And then once in a while where I kind of see the question or I have a question, Kiran, if that's cool with you, I would just interrupt, because I think often it's better to ask when the time is right and not wait till, okay. Exactly. Other than that, I would just like to say, take it away, and looking forward to this talk.
Yeah, so welcome everyone. It's nice to have you here. So my name's Kiran Bains. I'm a health psychologist. I did my professional doctorate at City. So that's the connection that I have, and that means I'm a practitioner health psychologist. So there's different ways of getting into health psychology, and and it will really depend on what you want to do and where you want to go. But I'll start with a bit of a recap of, I suppose, my path, my journey, and things that I've learned a little bit along the way. So I did my undergrad at Aston and Birmingham, and I worked in a hospital for a placement year in speech and language therapy. And then I did after that, I worked a couple of years with people with epilepsy. So funnily enough, I got that job as a support worker after volunteering with the Epilepsy Society and returning back to work with them. So I had quite an ongoing interest in long-term conditions, but I didn't actually know that I necessarily wanted to be a health psychologist per se for a little while. It just took me a bit of time to find my feet and figure that out. And then I did my master's in health psychology, and I became more and more interested, I suppose, in becoming a health psychologist. And that really sort of kicked off actually when I did an undergraduate module in health psychology. So that, that's where the connection was. And then I felt like with health psychology, there were two things that really drew me into it. Was that the link between mental and physical health, it seemed a bit more explicit, a bit clearer than, say, for example, clinical psychology, which I was interested in at the time. But I also felt that there was part of me that was interested in things like sport and exercise and things like that. And there was part of me that was interested in more clinical, areas of working. Whilst I was doing my master's in health psychology, not long before that, I started working with people with learning disabilities. And I found that was had quite an impact on me. And there was a lot that I was learning from my master's, that some of it felt really helpful to think about. Some of it felt like it was really falling short of what I was actually seeing happening in the settings that I was working in, where a lot of the models just felt like they might be from a foreign country, in terms of relevance, in terms of, ability to apply it, ability to bring change. And then after I'd finished my master's, not long after that, I'd become a research assistant on a screening study for people with learning disabilities. It was a national screening study, and we were designing an intervention. And I actually found during that job that I was much more interested in developing interventions than I was for screening. So I started looking for opportunities to further my career in health psychology, because that's what I figured that I wanted to do. And I reached out to a couple of health psychologists in the field to ask about my options, because at that time there wasn't actually a lot out there on different pathways into health psychology. There wasn't really anything formal.
Could I ask you, like, which year are we at? So you did Yes.
Yeah.
So
Yeah,
yes.
that when I that was in 2013. That was about a couple of years. So that was I finished my master's in 2012. That might be a bit of a giveaway of how old I am, but hey, we'll take that. And I was in my mid-20s by the time that happened. And I would say the research assistant job was my first graduate level job. Um, just like things could be a bit tough now. When I graduated, it was in the middle of a recession, and it was tough to, move forward. I definitely experienced moments of lows and low confidence, and my friends were really encouraging of me to take things forward and not give up on myself. So, there are going to be times when you have highs and lows, and that's okay. Um, so yeah, so that was in 2013, and then I did that research assistant job for several months. Then I started to look at different pathways into being a practitioner health psychologist and see if that was possible. So there are three routes as things stand. Well, there's maybe a fourth now, but at the time there was three routes. So there was a professional doctorate, which City, amongst a couple of others, offered. There weren't that many of those. Then there was a PhD with the stage 2, which gives you the research and practitioner qualification in one, and a PhD pays for the stage 2 fees. So that was an attractive option, and that was offered at Surrey and Southampton at the time. Things have changed a little bit since. And then there was the independent route, with the British Psychological Society. So that again, you would need to find your own your own supervisor, but you would do it with a competency framework to be able to gain your qualification, and so whilst you're working in practice. And then I suppose there is the other route, the Scotland route, where you work in with the NHS in Scotland, and you do short placements, and you are paid as a trainee health psychologist. Very competitive, worth checking out though, if that's something that you want to do. And that's much more, I suppose, from what I understand, it's a bit more like akin to a doctorate in clinical psychology, in the sense that you do a series of placements and build up your skills that way as a practitioner. So that's what I wanted to do. If you wanted to go into the research route, then PhD is your best option after the masters. And occasionally you can even get a master's by research route as well. So you're stage 1, so you're paid as a research assistant, and you're also get your master's qualification alongside it. It takes longer, but it is something that's worth checking out if that's something that interests you. So, but when you're trained to be a practitioner psychologist, your master's is your stage 1, that's your taught component, and then your stage 2, whether that's at university or through the independent route, that's your stage 2. That's where you apply your training and you show that you are able to do that and reflect as a trainee practitioner under the oversight of a fully qualified practicing psychologist.
Okay,
So
could I just so it means if I
yeah,
want to become a health psychologist, is it correct to assume that the main route would be for me to do a master's in health psychology?
yeah,
If I know first, I kind of know I want to
yeah,
do that, right? But then I would do a master's in health psychology. And once I did the master, then I go to stage 2. I
yeah.
work in the field. There's some person that kind of supervises me. And how long does it, how much, I think in organizational psychology, which has the same structure, I think it takes 3 years or so, and then you're, yeah.
So the bare minimum that you could do it in with the stage 1 and the stage 2 is 3 years. But that can often take a little bit longer with the stage 2, just because, like with any sort of doctoral degree or qualification, you need to write up your work, you need to have a viva, you need to be assessed for your ability to be an independently practicing psychologist. So in some ways, it's a bit of an equivalent to, say, for example, the doctorate in clinical psychology, doctorate in health, in educational psychology, except that those qualifications, their stage 1 and stage 2 is all in one. And the PhD similar, you do a certain amount of training, research methods, those kind of things. So the idea is that you do, in theory, 1 year of being taught certain things that you need to be able to do the research, and then you do 2 years of research. So it's kind of following that framework, and that's why it's, but it's split up in a slightly different way. Yeah. So
Thank you.
yeah, after that, so after my research assistant post, I looked at City. I started to look at City around near the end of 2013, start of 2014, and looked at whether my workplace could be. So I started working with people with learning disabilities back before, at the same job that I was at before I went to the research assistant post, and that's in the learning disability charity. Again, doing quite a bit of support work, quite a bit of activities work. I will say now I've never been an assistant psychologist, so I can't really go speak about that. I think that's probably more common for people who end up in clinical psychology, but I can see that there are some posts coming out now for assistant health psychologists, so it's worth keeping an eye out on that. And then I, had a conversation with the program lead at City at the time, who ended up becoming my supervisor later on. And they really talked to me through the whole process of what would be expected and what it would look like, what I would be able to do. At the time, I also spoke to the program lead at London Metropolitan, because they were the other place that did it in London. And again, they were talking about the kind of variety of things that people could do after doing the professional doctorate. So some people ended up, like me, using their existing workplace as a placement. Some of them ended up creating their own role within that to to really sort of become a niche, and then end up moving into a qualified position within that role because they were able to prove their value in their work setting. And some of them end up going to research. So actually, what I would say is that in terms of some of the things that you do during the qualification, there's a lot more overlap with, say, research than there is a lot of differences. So a lot of people who end up doing the PhD, for example, they will do a systematic review, or they'll do a literature review, they'll gather some data, they'll develop an intervention, then they'll roll it out, test it, and then that will be perhaps the bulk of their work. And where similarly, when you're doing something like the professional doctorate, you will be doing a review, you may gather some data, you may develop an intervention or two, depending on exactly on what the competency framework looks like and the emphasis of your school. And then you might be doing something like training and evaluation. So it's just that there's less emphasis on doing multiple studies than there is, and more emphasis on implementing things in practice. But there's still a lot of rigor there in both routes. So, and that's why you're able to sometimes combine a PhD with the stage 2 qualification, because you can use some of the same bits of work to tick off your competencies, as well as write up your research thesis. It just takes a little bit more effort to physically write it up in the way that you need to write it up for your doctorate. Yeah.
Could I ask you, so I think, I'm just thinking, I did a study on reducing alcohol consumption. Maybe I should kind of get my practitioner stage 2 qualification. But so if the place that I do my master's at in health psychology, would that be unrelated to the place that offers this kind of I don't know, supervision stage 2 framework? That would be, I would apply for that new, and I think City still offers that, and Metropolitan, or who's this in?
No, sadly, that's one thing that makes me a bit sad, actually, is that City doesn't now offer that qualification in the professional doctorate, which is, I don't know about the Master's in Health Psychology either. At the moment, it seems to be on pause. No, and that to me feels like a real shame personally, because I've seen so many people at the Division of Health Psychology conference, for example, that are from City. So there's that, but I know that there were other things that were going on in the time that were external to health psychology that were behind that decision. So it's just, yeah. So, but I know that Staffordshire offer professional doctorate. I believe that King's now offer the professional doctorate. So things do change, and it does help to check what's current, what's happening at the moment, in order to figure out where to go and do those things. So yeah, so that's something that's worth thinking about. And also the other thing I do know is that our division is looking at, has been having conversations with Health Education England to get some funded places for the professional doctorate. So that again is a really positive step in the right direction. So it just worth maybe looking at that. So for me, when I end up on the professional doctorate, I ended up doing it for 2 years part-time and 1 year full-time, and that was partly because it was self-funded and I needed to just be able to pay my basic bills and things like that. But I also will acknowledge my privilege. I did have support from family, which for me I couldn't have necessarily done that without. But I'm just, one of the things that we're trying to do, and I'll come to this a little bit later, is to try and make it a little bit easier for people for underserved backgrounds to be able to apply for places and to get into funded places as well. So yeah, so I ended up doing my doctorate at City and starting in 2015. Did that at the place where I was working with people with learning disabilities for a while. It was easier because I was embedded in the organization, and I ended up doing quite a bit of research with them to develop an intervention. And because I was embedded in a community setting, it was actually easier to do that research and get the data that I needed. And what I did was something that hadn't been tried before. I used the behavior change model to collect data with people with learning disabilities and people supporting them to develop my intervention. And to our knowledge, that's the first time that that's happened. So I was able to publish that later, and like the findings and the method that I used to be able to do that. So a lot of my work during the training was about, really the underlying theme was working with underserved groups in research and practice to understand their health needs and try and meet them. So alongside that, I delivered some talks on radio to like a South Asian audience, which is my background, on type 2 diabetes prevention and management. And then I also worked on systematic review around barriers to equitable healthcare access amongst LGBT adults, which I might be able to use in where I work right now to help them, the LGBT staff network, think about how to improve the way that staff support people from from those groups. And it's because there's a lot of people who wear things like what's called the rainbow badge, to be welcoming and supportive of people who identify as LGBT plus, and show that they're a safe person to speak to, but they don't necessarily know what else might be helpful in order to effectively support the people that they work with. So some of that stuff is still, things that I draw upon. So I ended up, having my Viva and qualifying in 2019. So like I said, it took a little bit of time for me to finish writing up, to have my Viva, had minor corrections, then had also you get a chance to delay finishing a little bit, which I need to do because I was in the middle of writing another paper for publication. So that all those kind of things, you do get a bit of flexibility, but it for me it was good to start part-time to figure out exactly what I wanted to do over the course of the doctorate. So it helps to look at for example, the British Psychological Society framework for the different competencies to figure out exactly what's involved, and what is expected of you. And then you can use that to figure out what am I going to be able to do within the context of my role, my placement, and what kind of things might I need to do in order to search beyond that, because you won't necessarily know from the outset everything that you're going to do. And that's all right, as long as you kind of maybe have a plan for 2 to 3 different competencies. So at the time it was like intervention, training, teaching and training, consultancy, generic professional competence, and there's always one that I forget. But there's those kind of things, and the research component as well. So I used like my workplace for a lot of that work, but
Well, just
I
like
did.
Kiran, okay, so
Yeah,
could I just so you finish your master, then you enter with
yeah,
City into stage 2. You have
yeah,
you find a supervisor, and now
yeah,
the BPS kind of draws out certain, like a framework for what you
yeah,
have to achieve in
yeah,
stage 2, and these achievements are basically defined. You have to acquire certain key competencies
yeah.
in order for you to demonstrate that you have them. You
Mm,
have to engage in them in some
yeah,
way, and then
yeah,
would your supervisor basically then kind of like basically approves of them, that she's like, oh, Kiran did enough intervention work, Kiran did enough generic career or
yeah,
whatever that was,
yeah,
um,
yeah,
and that's basically, and then at the end it sounds like it's almost like you have a lot of responsibility yourself in order to find things that satisfy these, right? You have to find some
yeah,
kind of professional activities that would help you to demonstrate that. So there's
yeah,
quite a like independent. And
yeah,
I think when you're referring, it's like, oh, there might be a certain time frame drawn up,
yeah,
but it could most often or most likely will take a little bit longer, because things don't just
yeah,
line up for you perfectly to demonstrate
yeah,
all the competence. But at the end of that, I think some of our students will not be familiar with that. You have the viva, which is like you defend basically your doctorate, and
yeah,
if that's approved, often with some kind of corrections, minor corrections, major
mm,
corrections, you have to kind of redo it a little bit, and then you get your doctorate, right?
yeah,
Okay,
yeah,
so this is why
yeah,
just to kind of, because some of
yeah.
the terminology our students might not be familiar with.
Yeah,
Okay.
absolutely. Yeah, thank you. Yeah, that filling that in. Yeah. So yes, those kind of things. That is the process. That's like the Viva is the oral exam that you have at the end to defend your work and to show that you've really that you've done work to the required standard. It's a good opportunity to showcase what you've learned along the way, and nobody's perfect, but it's also a good opportunity to show how you would deal with issues as they come up, because that's the kind of thing that they're looking for, is what would you
Yeah.
do to address problems as they come up.
But I
But
just like,
yeah.
Kieran, like Doreen says, defense seems nerve-wracking. How was it? How was your defense of your doctor?
Yeah, I mean, so this is going to sound a bit like showing off now, but mine was probably the most relaxed Viva I've out of all my cohort, I had the shortest one, because they pretty much told me that I'd passed as soon as I sat down. So that was all on the basis of my
Yes.
portfolio and what I put together. They would just said that you've really showcased your work, really reflected on it. You really showed that you've put you know produce work to that standard. And that was not just me, that was really good guidance from my supervisor, which I'm really grateful for. But it was just one of those that I had a clear idea of. For example, when I was developing the radio interventions, I had a clear example what the barriers were for South Asians in terms of managing diabetes from the literature, and what was said out there, and also a clear idea of how the models would help me to develop an appropriate intervention. And when I was going beyond the models, to be able to deliver things effectively and partition that out. And I think that they really liked the clarity of, when I was using models and constructs to frame my intervention and develop it, and when I was going beyond it. And my rationale for that, I was able to explain that these are some of the shortcomings. So you learn to be precise. I know that for a couple of the other people I know, they had a Viva that was probably about 2.5 hours, just over the double my time, but that was also because they'd done the doctorate within the shortest period of time possible, which was 2 years. And the idea of the defense is to make sure that you're ready to practice as an independent psychologist. You're ready to be able to make those decisions, and you're able to get the support that you need. So it's not meant to be a draconian process just to make you suffer. It's there for a reason. And honestly, that conversation I had really helped me to do, and they said that themselves, that the aim was to help me to address things that would help me to, for example, publish my work, or to think about what other ways I might do things. So it wasn't meant to be a punitive thing, if that helps at all.
Yeah, I don't think vivers are that bad. Yeah, okay. But let's just tell us a little bit what happened thereafter, and maybe also a little bit what you do on a daily basis now.
Yeah. Yes. So after I finished that, I ended up, like working a bit, and then I found I should say, during the training, one of the best things I did was set up a WhatsApp group for me and my fellow trainees, so that we could talk and exchange tips and support each other and help each other to, like, for example, do a bit of consultancy work. So really, honestly, you're working with other people isn't unnecessary. Can be a really good thing, and it can be a really good opportunity to reflect on what you're doing as well and learn from each other. So after that, so I got signposted to a role by someone who was still on their training, and she said, "Oh, I think you'd be perfect for this." And it just so happened to be in improving access to psychological therapies, working with people with long-term conditions. And I'd started to do some top-up training around this cognitive behavior therapy for physical health. I've got really interested in working therapeutically with people, and that was and then I ended up doing that for 2 years. I ended up being in improving access to in IAPT for 2 years, as it's known, and developing the pathway for people with long-term conditions to access the service and have appropriate psychological therapy support. So I got to use some
could you she's like, let's say it's Tuesday morning a year ago, so you did it for 2 years. Like, what would you do? Like, what is I think I obviously understand what it theoretically means to remove barriers, right? I just, like, how does that look on the ground? Like, how does that, like, what would you actually do?
Yeah, so for that role, I ended up, so there's a number of conditions that they wanted people, that NHS England wanted services to be able to provide therapy services for. So that was chronic pain, chronic fatigue syndrome / myalgic encephalitis, the irritable bowel syndrome, diabetes, and I think there was a skin condition as well. So there are a few different conditions that we would commonly see, and then sometimes we'd also see people with other conditions. So part of what I did was look at the kind of the literature on how people to manage these conditions. Chronic obstructive pulmonary disorder as well. So how people would manage these conditions, how they would make sense of their conditions. So like using something like the common sense model of health and illness, Leventhal's self-regulatory model, and what kind of data came out from that. So for example, with people with diabetes, fear of consequences could lead to a lot of anxiety and hypervigilance, but it also led to more regular self-care. So I use that to think about what kind of cognitive behavioral techniques might be useful to help people to keep their stress manageable, but also perform self-care behavior. So again, with health psychology, there's a lot of emphasis on behavior change and behavior maintenance. So I would bring in things about how to create habits, maintain those habits, how to manage stress, how to be a bit more compassionate towards themselves, because that was also quite effective for people with diabetes in terms of self-care and regulation of blood sugar levels. So those kind of things that would be some of the things that I would do, and then bring that together, develop an intervention, pilot in groups with people, with service users, and then also teach and train other people how to do that. So I didn't have to do all of it myself. There were some programs that were out there developed by different psychologists in research settings, which I use, and then I would tweak that based on my understanding of the research.
Cool. Okay. That sounds very good. Yeah.
In terms of barriers to access for the service users, I also reflected with staff using certain models, like the social ecological model, which looks at different levels of barriers and facilitators at different levels of the population. So from individuals to groups to an area to and kind of reflected with people on, okay, why are we not seeing, for example, a more racially diverse group at this level? That's quite common. You see more racially diverse people in mental and physical health services at more secondary and tertiary care levels rather than primary care. Or why are we not seeing, for example, more like LGBT plus people who might be more likely to have COPD because things like smoking rates are higher. So, what's that about? So why are we, so it was just kind of got people thinking about, who are we seeing and who are we not, and proportionally, what might we expect, and how does that mean, how do we adapt our services? So I also delivered training on working with certain underserved groups, including LGBT plus people, based on what I'd already done as part of our CPD session. So we'd have a CPD session once a month, and we'd have different people delivering things on different topics. Also did some work around learning disability and accessibility, based on my past experience. So those kind of were the things that I did quite a bit of in that role.
That sounds great. CBT, just for those cognitive behavioral therapy, if you're like year one or two and you haven't done your clinical stuff yet. So kind of like a traditional approach, the most used approach to kind of restructure people's thoughts in order to help them to feel better and to act in line with what they want to do. So this sounds really good. I think one question that immediately popped into my head is like, you finish your doctor, you defend your doctorate, and then what is, like, if I finish my health psychology, like if I'm a doctor in health psychology, what's the job market like? I think you mentioned, it was helpful that I had this WhatsApp group, and it's like, okay, is it hard to find something, or is it like?
Sometimes it depends. There's more opportunities now than there ever were, and certainly within my trust, for example. So I moved from that job to my current one. I'll talk a bit about that in a moment. There's more roles coming up for people under practitioner psychologist roles, because there's more recognition for that people with long-term conditions need particular specialized support. So that's certainly in therapeutic roles, there's quite a bit out there, and that's more what I was interested in. There's quite a lot of health psychologists that work in public health and with local authorities, and so there's quite a few that have done work around behavioral science. For example, when COVID, when the pandemic started, there was, on a paid and unpaid basis, there was a whole bunch of us health psychologists that got together to offer support in various ways. So I was part of a subgroup of people that did a systematic review, a quick review on reflective practice for frontline practitioners, working with people with, say, for example, cancer, and that the recommendations that we gave ended up being used by Public Health England and Macmillan, and so those kind of things do. And some of it is also about getting to know people that are already in the field to be signposted to some of these things. There's more networks now there are of practitioner health psychologists that exist. There's one in London that I'm part of. There's another one in Manchester. But the Psychological Professions Network also has sub-networks of different professional groups, including health psychologists. So it's easier now to find out about these opportunities and to, to apply for them than it was maybe a few years ago. It's
Okay,
growing.
that's very helpful. And then I think, okay, I feel like I have a good idea of what somebody who works in public health would do for local authority, kind of helping them to maybe help the citizen in that area, or to kind of maybe become more active, or things like that, kind of school interventions or workplace interventions. Could you talk a little bit about what have others of your, like what would be something, because I think sometimes I'm obsessed, let's say I'm obsessed with exercise or something. I think you mentioned it in the beginning. Like, what are maybe like other psychologists, health psychologists, what are they doing? What's like the variety? Because I could imagine there's a huge diversity in what people do.
Lots of diversity in what people do, and there's sometimes a lot of overlap sometimes with, say, exercise psychologists, in some saying. So say, for example, workplace, you're developing a program for people to exercise more. There's but I suppose in my like specialism, for example, working with people with various long-term conditions. In my previous role, exercise was a significant part of what helped, say chronic pain. Managing exercise was something that would be helpful, because sometimes people would be afraid of exacerbating pain, and then they would end up getting muscle deconditioning. So we would use perhaps therapeutic models as well as behavioral science to be able to help people to build up their exercise levels and create goals and monitor their progress. So there was that kind of stuff in my current job. So I work in hematology in Central London Hospital, and that kind of the exercise, like over exercising, particularly for people that I work with sickle cell disease, can actually lead to sickle cell crisis. So actually you have to really fine tune what might be manageable for a person, especially say for example in winter, where they might be more likely to have crises, or in summer when things are really hot, they're more likely to have crises. So you really kind of need to think about how people might monitor themselves and figure out what might be accessible to them. So that might be sometimes less cardio exercise, it might be more strength-based exercise, which can also be quite helpful sometimes for people with limited mobility. You might also think about the kind of cognitions and the fears that people might have around exercise, and some of that is, we might think of cognitive behavior therapy as correcting irrational fears. Traditionally, a lot of people with long-term conditions do not have fears that are irrational, so it might be so the kind of ways that you work with people are quite different in terms of acknowledging maybe a bit more problem solving, maybe a little bit more like kind of figuring out whether when stress might be coming into the picture and exacerbating issues. So some of it might be a little bit more behavioral, or challenging sometimes unhelpful thoughts. So if you're dwelling on the fact that you have this condition and for whatever reason your life might end prematurely, which may be the case, if something that might be unhelpful for you is dwelling on that and then not actually doing anything that's important to you. And even though that might be true, so it's about helping people to improve their quality of life. And I use acceptance and commitment therapy now and combine that with health psychology models. I use compassion focused approaches again, combine that with health psychology models. I'm going to be doing narrative therapy training soon and thinking about how that interacts with things like illness, identity. I do quite a bit on thinking about adherence, why some people might adhere to some of their medication and why others might not. And think about how we can work with healthcare professionals around helping people to manage that. So like in my current job, there's more of a therapy caseload, but also like we do training on a trust-wide level within wards and those kind of things. I also, one of the key differences I suppose here is now that two of them. One, we see people more during routine medical care, so for reviews rather than when they come to us for therapy. which is like sometimes where we do brief interventions, and there's an opportunity there to teach people about adherence and what kind of things might help or hinder that. And the other thing is I facilitate our patient support group. Now I work with for people with sickle cell specifically, and because they are racially underserved and they are very aware of how racism operates within services, and we have conversations about that, that I can do more work around things like advocating and supporting self-advocacy. And some of that will take me beyond health psychology model, but I'll bring in some of my health psychologist knowledge around that kind of stuff. So it's just a bit more organic rather than structured.
Okay, I've the two. I need to ask two questions. The one question I have, it's probably easier to answer, is are there any private private employers? Because it seems like either public health or NHS. I think some might feel like, oh, I'm not sure if I want to work for public health or NHS. It's like, are there health psychologists that work in a private sector? Do they would within organizations then, or what would be?
I mean, I do a little bit of private work, and that's within a therapy service, and I'm the first health psychologist that they have at the moment, but they have more people coming in with long-term conditions for support, and are looking to expand that offer. So that's becoming more of a norm. I think it's easier if you do it within a wider organization, because they are, trying to get people to refer to you, especially when not many people know what health psychology is still.
Yes.
Then that can be quite a challenge, and also it means that you've got a bit of support around admin. But sometimes people do end up working in private practice, often it's easier if they've done some work in the NHS before as well, because that's how they build up connections and experience often. And then it's much easier to then also get clients coming into the door, and that might be directly or through working with an organization who wants to refer clients to you. So
okay, yes, that makes sense. Okay, I mean, if I look at the people, counseling, clinical, health, educational, all of them are kind of basically saying, yes, I do a little bit of private work, or I try to do more private work. That seems to be something people are interested in. And I think kind of maybe also finding a balance between the NHS work and something else. I think that is probably really healthy. Now I have a really difficult question, I think, or maybe it's easy to answer. It's like, if a student comes to me and says I don't know, should I do clinical psychology, educational psychology, organizational psychology, or health psychology? Okay. It's what would be the thing where you would say, what really makes you distinct? Because a lot of the things I feel like I hear from you, CBT, patients, I mean, there's obviously chronic conditions, but I could also imagine that, I don't know, it doesn't sound so far off clinical psychology. And it's what makes, what do you say, oh, I think you should look into health rather than clinical? What is it that could you kind of highlight that a little bit?
I think it's the use of health psychology theory, models, and research to really inform your practice. I think that of course I'm probably biased, but I think it's been really helpful for me to be able to combine therapeutic models with health psychology models to offer that blended approach. I definitely think there's more understanding potentially if you've done some training in health psychology in understanding how people models around health and illness work, and bringing that to your practice. And there's definitely more specialist understanding about how to help people to change their behavior and manage things like medication that are helpful. But I also, the other thing that I find that there's something exciting about being part of a younger discipline, and for me that was definitely part of what drew me in. Now I'm the Division of Health Psychology, Quality, Diversity and Inclusion co-lead, and that was possibly easier because we have a smaller community at the moment, and because we're a younger discipline who can potentially learn from our bigger brothers and sisters about what's went well and what hasn't went well about bringing
Yeah.
about institutional change. So I've
Mm.
definitely felt like that some ways that's been an opportunity for me in the
Okay.
here and now,
Yes.
Yeah.
So I think like, okay, I like it. I think, I mean, there, so, some things really feel like, oh, that sounds a little like clinical psychology to me. Some things that sound like, that sounds more like counseling psychology. It seems
Yeah.
like you have much more freedom than a clinical psychologist, right? There's some things that really sound like organizational psychology to me, where it's like, okay, we're in an organization and we want them to, I don't know if it's a school or it's like we want them to move more, maybe to eat healthier or to practice some kind of stress relief,
Yeah.
which is like, okay. And then there's something, I mean, obviously really unique about talking to, I mean, this is like so stupid, but it's like your service user is basically me in a difficult situation, right? I get
Yeah.
a chronic disease or somehow, right, I have sickle cell and I'm not mentally like I don't have a mental disorder. I just have to kind of make sense of like, yeah, my body is not doing what I want it to do.
Yeah.
And I think that seems to be, it seems to be subtle, but really meaningful and significant to work with like the difference between somebody who's depressed or somebody who's down because their body is letting them down.
Yeah.
So I think it's quite, um,
And there's definitely a process of adjustment and readjustment, even with lifelong conditions, that people go through, and thinking about aging and thinking about the specific challenges that young people go through. There's definitely some of those that is quite interesting to see that different. Also, when difference between an acquired condition slightly later in life versus one that
yes,
might be
yes.
acquired in childhood, or that someone will be born with. And so I find that really fascinating. But I also do like that what you said about freedom resonates with me a little bit, in the sense that I can use health psychology models to think about what we need to tackle, and think about the overarching structures of what we might need to change. But I also do use the opportunity to not just use health psychology models. There's still so much that we don't know from a health psychology perspective about advocacy. What does that look like in terms of that kind of more big social systemic change? And I think that's part of where my interests lie, in terms of how do we bring that in, and where do perhaps we as a discipline fall short sometimes, and how do we change for the better in that sense, in understanding the social context of health and illness and how we might perceive that. So yeah, so I think there's definitely sometimes
So
it's
let me
quite nice to
pick
be able to do that.
let me pick up on that and ask something about contextual barriers to become a health psychologist.
Yeah.
I think as I see, you have to do your master's. The master's is like you have to pay for that, right? What are the costs thereafter? If I do at King's or at, I think London Metropolitan or whatever I think was the other one, or like
Staffordshire, for example.
Staffordshire.
Yeah.
If I do this the stage 2, what are the costs of that? And then ideally I probably earn while being involved in some of these competencies, but could you talk a little money? I think
Yeah,
that would be
it's yeah. I mean, it's always been a bit difficult, seeing how much it can cost. I think that's a fair point. I remember, like, I know it may have changed, but for the masters, it might be easy £6,000 or something like that. And with the professional doctorate, when I was doing it, was about £6,000 per full-time year. And when my training actual work with people with learning disabilities in that organization was unpaid, because I was working with a very poor and underserved group in a charity, so that wasn't really so much an option.
so
It's
what
just
did you
like,
do? How did you get money?
oh my gosh, I still worked a lot. I worked part time a lot. Well, I mean, like a lot of hours alongside my doctorate for the first couple of years, and then after that, I just had enough to sort of get by. But that's where
Yeah.
the family support ended up being really helpful. But that's why I'm trying to say to people, it's not, and trying to push for funded places, it feels really, really important that in order to make it more accessible. But the flip side of that is, for example, clinical psychology doctorate programs are almost fully funded, but the number of people that from, say, for example, racially underserved communities that get in, aren't that many, even though that the interest is there and there's more being done to be able to address that. But it's it's something that is a challenge, whereas sometimes with self-funded courses, actually ironically, you see more racially
Yes, that's true.
like served groups doing that. So it's just a real something that we really need to do. And I've kind of very much since the start of seeing these posts and these discussions about health education in England, posts for training health psychologists, I've said, well, let's try not to do make the same mistakes and make it a little bit easier at the same time to have people from underserved groups in our profession, because it feels really important to be able to do that. And then it's also easier to create posts on the other side for people from like diverse backgrounds working in the services, who some of us, I will say that I possibly find it easier to talk about racism than some of my white colleagues do with our clients. And yes, they've done quite a lot of work to be more comfortable, but if, say, for example, I'm drawing on an approach which acknowledges that racial trauma isn't necessarily something that could be fixed, but something that we live with and manage and cope the impact, try and push back against, it's easier for me to say that than for my white colleague to say that, because it probably feels a lot easier for a person to listen to.
Yes.
That one else is ostensibly going through it. So there's some elements of that which I think we need to give more value to. So yeah.
All right. I think my practical questions, I think if like any one of the students wants to ask, there's a chat question. Oh, there's just a thank you. Tatiana's typing something. I think, let me just look at my notes. I think we talked about the cost. We talked about employment chances. We talked about stage 2. Yes, I've like, what kind of sport are you interested in? Because you started in the beginning, it was like, oh, I wonder what she's interested in. I'm not sure.
Yeah, I play football. I always have, so
Nice.
yeah, that's my passion. I was going to say,
yes,
in terms
that's
of
a
paid
great.
posts, that's a good question. I was just going to say, in terms of training, if we get a post as a research assistant, that could be or assistant psychologist, that can be a good way of getting funding, or at least somewhat, for your training. So something to worth.
So the question, just for those, is there anything you wish you knew before getting into health psychology? Is the question, really great question. And I think if I could tack on at that, that's actually traditionally my last question. Like, if I'm a student, it's like the students are listening, or like we're watching the recording, or so if I'm kind of interested, it's like, oh, that sounds interesting. I'm in year 2. What should I do? So I think maybe
I think the one thing that I kind of wish I'd understood perhaps was that even though there is opportunity for change within health psychology, sometimes it can be difficult to bring about the changes that I think we need to see happen. But I've learned since that, for example, systemic change, is something that, bringing people along can still be challenging sometimes. I know that this can take a few years for us to really do that. But I think on something really important that I learned along the journey was the importance of collaborating with people, within, who are very much, say, within the core of the discipline, involved in division health psychology, and very much embedded in it, and also like working with people who are outside of that, you know, who perhaps maybe are a bit more critical of what health psychology is about, and you know, can, you know, see what some of the difficulties and the differences. And I've really tried to use that kind of the tensions in order to start bringing about change. I don't think it's very easy to do that if you're just very much within the centers of what the division of health psychology is, because in some ways they are, perhaps it's the easiest, they are in the center for a reason. It's hardest for them to change things, whereas people who are perhaps a bit removed can see some of the issues more easily, and they have a lot of valuable things to say about that. So something that I've learnt since then,
being patient.
yeah, definitely being a bit patient.
Yeah. So just
Yeah,
like, because I think we're kind of like our time's up, and I think just to like, let's say you're like, you want to tip your toes in a little bit of health psychology, you want to maybe get some work experience to see for yourself how like, how is it, do I like it, do I not like it, etc. Like, what is like a good place to start?
I
um
I mean, I think, you know, there's a couple of things that can be good to start. I don't know if you, in the undergraduate program, if you have, say, for example, a module in health psychology, it can give you a bit of a
we do.
taster. Yeah,
Yes.
so that's a good place to start if you're interested in that kind of thing. In terms of things that I find found helpful earlier in my career, is I had my paid job, but I also, for example, volunteered 1 day a week on a project around, you know, addressing health issues, you know, amongst underserved women. You know, so I like volunteered in a charity for 1 day a week on, you know, for LGBT plus, well, lesbians and bisexual and queer women, for example. That was a 1 day a week thing. But I would say maybe if it's something like another community that you care about, that you like perhaps find something where you can use a bit of the knowledge that you've already gathered in order to do that. But the reason why I say 1 day a week is so because people still need to, you know, you have to earn things and pay their bills and things like that. So it just allowed me to kind of start to get a bit of an idea of whether that kind of work really interested me or not. The other thing is, when I was doing support work type stuff,
Yes.
it was just thinking about, okay, you know, some of these models, for example, that I'm interested in, how could this potentially be useful for my client group where I'm working at the moment, and can we potentially start to think about bringing these like sort of brief things in, you know, to help people to, yeah, it's just a way
But
of
Kiran,
starting.
you're too
Yeah.
advanced. You have to remember how it is to be an undergrad. There's like,
I know.
yeah.
It's really tough, because I think the thing is that one of it is, you kind of end up, the kind of way that I end up going into it was very much kind of creating opportunity and
Yes.
using my initiative in that
Yes.
way. And that, I think that's, you know, something that we need to think about, you know, whether it's something like mentoring, or,
Yes.
you know, to try and make it a little bit easier for people to sort of implement
Mm.
some of these things. One of the other easier ways, I guess, you know, if you are kind of interested in research, and, you know, a lot of people in universities, you know, for example, your lecturers, I'm saying the students, might have a health psychology project going on, which you can get involved in. And then that
We
allows
do.
you to be a bit more guided in terms of thinking
Yes.
about whether that's something that interests you.
Yeah. Okay, that sounds great. So basically, uh, you can kind of tip your toes into the research side,
Yeah,
or I think it sounds to me like a really good way would be to be a. Some of our students work part-time as support workers, and there probably is like ways to do this with people who have chronic disease, or like within the context. I think that would be really good. All right. I think,
yeah,
thank you so much. It's like reviewing your whole career. I hope that was enjoyable for you, bringing back some memories. Yes, thank you so much for doing that. and it sounds like you're having a great job. I think, let me have a look if there's, or we can just stop the recording. If there's a question coming up, then I will then we can just quickly address that. All right. Yes, so thank you. And I'll try to find the stop recording button. Record and stop recording. I did